Welcome back, West Michigan. You are watching Alive and Well. I'm Lynda Balkema, and with me is Dr. Stephen Zonca, plastic surgeon here in Muskegon, and we are talking about breast implants. We've talked a little bit about why women might want breast implants, and sometimes they just need them following a surgery, and sometimes women need breast reduction. And so the difference, we want to talk about how this is putting an implant in. About how long does it take if I were to come to you and say I want this done?
Less than 2 hour procedure typically, and it's done as an outpatient surgery. Come in, go home the same day. It is not a terribly uncomfortable procedure. There's certainly some discomfort with any surgery, but sure. It's a reasonably quick recovery. We don't want people going out and playing soccer, next week, right. But nonetheless, you can get back to life in a reasonably short time. Many people take a long weekend to recover from this and go back to desk-type jobs. Certainly, someone who works in a more strenuous activity is going to have, a little longer recovery before they're going to be able to go back to heavy lifting.
Okay.
And we had also touched on breast reduction. That's another common procedure that we perform to help women who are excessively large. A lot of problems with pain in the shoulders and upper back.
And now sometimes that's considered medical also, and can be covered sometimes by insurance. I know it's a little different with the breast enhancements considered cosmetic, correct?
That's correct.
And it's a much simpler procedure. Is it just kind of is it one
It's
incision?
Typically a small incision underneath the breast,
okay.
That where we put the implant in for the breast augmentation or enhancement. For the breast reduction, it's a little more involved of a procedure, and typically it can be done as an outpatient procedure, but most commonly is done as an overnight stay. There are more incisions on the breast because we're not only removing breast tissue, but we're removing some of the extra skin towards the bottom of the breast to leave a more natural shape.
Sure.
Compared to previous, and
do you actually remove the entire nipple, the areola? I mean, I don't want to scare people out there, but it's a thought. You're completely under.
It's actually moved upwards. It's not removed at all, it's still attached to its blood supply and sensation, so that most women have very normal sensation after everything is healed up, and they've
made such great strides in this from what they did years ago. I think
everything continues to improve all the time, as far as the not only the procedures but anesthesia and recovery from that, and so we find that while breast reduction may have a slightly longer recovery, it's still for women who are in need of that surgery certainly a great procedure, right. And a lot of relief as far as the back, neck, and shoulder pain,
shoulders, all of that. And then the third reason for breast augmentation would be after surgery, after having a mastectomy for breast cancer, you can reconstruct a breast.
That's correct. And the reality is that breast cancer is very common. Nearly 1 out of 9 women in this country will develop breast cancer. And if the option is removal of the breast, then we have several options to reconstruct a breast after it's been removed. The most common way is typically with implants, as we've talked about. We first would stretch the skin and muscle and then put a permanent implant in. Another way that we sometimes reconstruct the breast is by using tissue from the abdomen. That's called a TRAM. TRAM flap, and that's using skin and muscle from the belly to reconstruct the breast. Not every patient is a candidate for that, but it can be a nice way to reconstruct the breast. And then finally, we can use a skin and muscle from the back called the latissimus muscle. That gives us another option for breast reconstruction. And certainly in breast reconstruction, we see women who've been through breast cancer, and that this allows them to get back to doing most of the things they were doing before without some of the limitations of an external prosthesis, and to feel good about themselves.
Feel good about themselves, because you already have that trauma and that awareness that, wow, cancer, what an awful scare, what a word that just scares us all. And to go from that, and then as a woman thinking about losing your breast, you don't we all kind of take our breasts for granted. We really do. And this is all the more reason women get your mammograms done, do your self checks every month, please, please, please. But
absolutely,
it's wonderful that you can reconstruct a breast. And I know that you even go to the point, I looked online, and you can go, can you give our viewers your website?
Our website is www.msa-plasticsurgery.org. You can also go to our office website, www.msapc.com, and there's a link on there to our plastic surgery component of the website. And with those, there's a variety of information on different procedures.
There's pictures of actual before and after breast. But what amazed me was how you reconstruct a breast, and I mean the nipple and everything looks so normal, so regular. I mean, it does. It looks
procedures that we can do to not only reconstruct the nipple but the areola surrounding it. Sometimes that involves a small skin graft. Sometimes it involves actually tattooing the areola back in place, and it makes it look much more natural. The first portion of the reconstruction is creating the breast mound and gaining symmetry with the opposite side, but then we try and make it look as natural as possible, and through several techniques we were able to really provide an excellent result for many women.
I was surprised when I saw tattoos, because I'm thinking tattooing and blue, or I mean they looked very natural, very real, and I just think that's such a great thing that you can do that. And you mentioned that this is the stretcher.
That's correct.
That would go after a mastectomy to kind of stretch that skin before you could actually move. Would that be the same whether you were using an implant or if you were using the muscle from, say, the stomach, or is that different?
You would not need an expander if you were using the muscle and skin from the stomach. That's a little more involved for procedure.
Sure.
Women who've had previous surgeries, it may have damaged the muscle of the abdomen, and so sometimes previous surgeries are contraindication to doing that, but many women are candidates for using the skin and muscle of the belly to create a breast. And it's another option, another tool we have to reconstruct the breast after it's been removed for cancer.
Well, that's good. That's wonderful. I think we're going to move from breasts on down the line a little bit, so to speak, and we're going to talk a little bit about tummy tucks. And you also do quite a few tummy tucks, I understand.
Yes, it's a very popular procedure, and any woman after pregnancy,
or midlife,
the skin of the abdomen has been stretched from pregnancy, as well as the muscles are typically separated. And so what a tummy tuck does is it removes the extra skin following a pregnancy, and even though the skin may go down, there is still residual loose skin typically of the lower abdomen. There may be some of the upper abdomen, and we also address the stretched muscles. We bring them back together, and it is a surgical procedure, typically done as an outpatient procedure, and there's a little more recovery from that than, for example, a breast augmentation, but most patients have some soreness, much like a C-section, where they may be bent over at the waist for the first 2 to 3 days, and limited lifting for the first couple of weeks after surgery, but certainly a very reasonable recovery for that, and it helps women get back their pre-pregnancy body, or, for example, after...
We all like to have that back.
And after weight loss also is another significant... We certainly see many people who've had the bariatric surgery or on their own have lost a significant amount of weight and end up with extra skin on their abdomen, and so those can all be addressed there.
Now, have you ever told a patient, do they ever come to you and you think that, no, all you need to do is a few sit-ups? And, is there a fine line somewhere between really needing the surgery, or just is it all about how they feel?
Well, there are certainly people who need to lose weight that are maybe not a good candidate for this. A person who's a good candidate for a tummy tuck is a person who is at a reasonable or close to a normal weight, and has extra skin, maybe a little bit of extra fatty tissue, but this is not a weight loss procedure. It's for people who are at a reasonable weight and that they want to improve the tightness of the skin skin,
Tightness of the skin.
and maybe remove stretch marks along the way.
Okay. Well, when we come back, we're going to talk a little bit about liposuction versus the tummy tuck. I'd like to learn about lipo. So stay with us. We have lots of interesting topics to cover.